So welcome to EuroPCR 2021. My name is Joost Damen, interventional cardiologist in the Thorax Center in Rotterdam, the Netherlands. So clearly, the use of IVUS demonstrated to optimize short and long-term outcomes in patients presenting for PCI. So IVUS-guided PCI improves outcome. However, at present, there's a gap in the evidence for patients presenting with STEMI, since dedicated prospective studies focusing on the use of IVUS in the setting of primary PCI are lacking. So the SPECTRUM study is a prospective observational single-center study focused on the safety and efficacy of IVUS-guided PCI in patients presenting with ST segment elevation myocardial infarction. The intention of the study is to use IVUS in a protocolized manner for patients presenting with STEMI, meaning we will do an IVUS pullback pre-PCI, we will do an IVUS pullback after the first maneuver, which could be either thrombectomy or balloon dilatation or wire crossing. We'll do a pullback after the first stent implantation in order to assess the stenting result, and we'll do a final pullback to assess the final post-PCI result. So there's at present little data as to how IVUS will affect stent implantation and/or treatment guidance in patients presenting with STEMI. IVUS can help to identify the true cause of the luminal obstruction in patients with STEMI, which is typically thrombus, but IVUS helps to underline the exact amount of plaque which is in the coronary, the amount of vasospasm, which might help in order to improve stent sizing, and the quantification and qualification of the thrombus burden might help to guide future thrombectomy strategies like aspiration thrombectomy or specific 2B3A use in patients with large thrombus burden. So at present, there is conflicting evidence with respect to the use of aspiration thrombectomy. While the TAPAS trial 15 years ago demonstrated that the use of thrombectomy improved patient outcomes, subsequent large randomized controlled trials disputed this evidence by stating there was no difference in the use of aspiration thrombectomy. Our hypothesis is that by making a better appreciation of the amount of intracoronary thrombus, the duration of the thrombus, and the aspect of the thrombus, specific treatment strategies like the use of aspiration thrombectomy or the concomitant use of thrombotic agents like 2B3A inhibitors might have a particular benefit in patients presenting with certain types of thrombus. Moreover, the use of IVUS will help to guide potential treatment in patients with large versus low plaque burden and concomitant thrombus to allow thrombectomy or maybe to make the thrombectomy less efficacious. So the intention of the SPECTRUM trial is to assess current treatment strategies applied in patients with specific plaque characteristics and to assess post hoc in an observational study the particular effect of the individual treatment strategies linked to the individual amount of plaque and thrombus burden per patient. I do believe that newer IVUS technologies like the one we're using in the SPECTRUM trial might help to drive adoption of the use of IVUS in STEMI patients because of two reasons. First, the novel technologies like also the Assist Kodama IVUS catheter with a broadband transducer with 60 megahertz, allowing a very good radial and axial resolution, helps to facilitate image interpretation. Because of the better resolution, the interpretation of plaque, thrombus, and dissections are really a lot easier as compared to the initial 20 megahertz systems. Second, newer technologies like this system offer faster pullback speed without compromising on the image quality. So here we are using a pullback speed of 2.5 millimeters per second, which is 5 times faster than the initial IVUS pullback speeds, which were typically at 0.5 millimeter per second. So that brings down pullback times in the long LAD 5 times. So that makes the application of the technology safer and easier, particularly in patients presenting with STEMI. Particularly in this setting as well, multiple pullbacks become feasible because of the limited additional time that is needed to rerun a pullback. Thank you for listening to EuroPCR 2021. Have fun with the rest of the course. Thank you and bye-bye.